Okay, so in palliative care, this is the subcutaneous device that we would use quite commonly to give you the stat doses or continuous subcutaneous injections and infusions through. This is a 24 gauge needle and it has a single lumen, but they do come available as well with Y connectors, but we tend to just use the one with a single lumen. So we're going to be inserting this into the patient's skin with an aim to either connect the syringe driver infusion or to give stat doses through. So the first step is to pay attention to hand hygiene as per local infection control guidelines. The next thing we're going to do is to clean the patient's skin. We're going to thoroughly rub the area with an alcohol rub, and then we're going to allow it to thoroughly dry afterwards. While that's drying, I'm going to put on my gloves. And then I'm going to open the packaging. So to open the device, you simply lift the corner by the arrow and peel the cover back. And take the device out of the packaging. Now you'll notice that on this yellow section there are arrows on one side and there are bubbles on the other side, and we'll be laying it bubble side down next to the patient's skin. We tend to remove the gate clamps here. They're in addition to the clamps that are being used on the infusion device giving set, so there's minimal need really for 2 clamps, and it tends to dig into the patient's skin. So the next thing we're going to do is just loosen the cap to make sure it doesn't stick, and we're going to drop that into our collection tray. We're going to make sure that our bevel is side faced upwards. The bevel on the edge of the needle is faced upwards, and I'm going to use the 2 arrow sections to pull back. So I'm holding the bubbly sections underneath, and I'm going to put it into the subcutaneous skin by pinching it to make sure I've only got subcutaneous skin, and I'm going in at a 45-degree angle. All the way up to the hub of the needle. I'm then going to secure the device and use the ridges on the end here to completely pull back in a fluid movement. You can see the device is now containing the needle, which then just pops off. So your needle is now contained in the cassette here to avoid any chance of needle stick injury. That then should go into your sharps bin. I'm then going to secure the device with my transparent dressing. And placing it firmly over the skin. The final stage then, you can remove the bung and connect up your syringe driver giving set to it.